Don't mind us here as we're moving chairs around. We're part-time furniture movers at the World Health Social Good. And I think this is going to work to get everybody around the table. Like I said, the benefit of the technical briefing is that we can grab all of the experts. And I certainly have some of the best here around the table. I have Dr. Tim Evans, who is the Senior Director for Health, Nutrition, and Population, the Global Practice at the World Bank. And we will give him the tough question that just came in. We have Dr. Boerma, the Director, here we go again, the smart man, Department of Measurement and Health Information Systems at the World Health Organization. It's quite a title, isn't it? Yeah.
Where does he work?
World Health Organization, that's the easy part of his title. And then we have Faridah Luyiga. Am I saying that right? Help me out. Where's your microphone? Help me out here.
Faridah Luyiga.
Thank you very much, from the White Ribbon Alliance. So send your questions into these guys, hashtag WHA68, hashtag SocialGood, and we're going to start by asking Tim Evans a very difficult question here. And that is, a blue circle means a question from Twitter. What is meant by sustainability in health?
Do I use the microphone?
Yes, please.
Okay. Well, sustainability in health is a tricky complex in the sense of the physiological dimensions of sustainability, but those are all the things that you need to keep healthy. If you think of those relate to food, those relate to shelter, those relate to access to healthcare when you're sick, right? And if all of those elements are in place, then over the course of your lifespan, you're likely to be able to sustain your health. So sustainability really is a reference to those factors, those prerequisites, those foundations, those services that every person would need to access across the course of their life in order to enjoy the highest attainable standard of health.
All right, thank you. That was very helpful. Tees, let me come back to you. You were here just a moment ago, and we were talking about the Millennium Development Goals. Millennium Development Goals, we had 8, if I remember correctly. Nearly half of them probably involved health. What are we looking at now for the next 15 years with the SDGs? What are we looking at for the health piece of that?
So the proposal from the so-called Open Working Group, which was discussed in the UN General Assembly last year and pretty much accepted, so it will now move into the outcome document, which will be discussed in September for adoption in the UN General Assembly, has 17 goals. 17 goals, and one of those is a health goal. And then under each goal there are targets. In total there are 169 targets, and 13 of those are health. So in terms of the prominence of health, you would say it's less prominent than before. It's also important that the new agenda, whereas the MDGs were very much focused on poverty, improving health, education, this new SDG agenda is about all countries. So it's an all-country agenda, and it addresses the economic, the social and environmental issues. So that's why perhaps health is less prominent as a goal, one goal, but health is in all other goals as well, as a contributor, and also as a beneficiary. So in education, nutrition, poverty reduction, climate change, equity, water and sanitation, these are all goals, and we all think that there are very critical linkages with health. Sure. That need to be explored and lead to intersectoral action in the next 15 years.
Okay. Faridah, let me come to you here. You're a strong advocate for citizen-led accountability. Talk about the accountability aspect of the SDGs. What are your concerns?
My concerns are that we need to involve citizens in accountability. Through our efforts as White Ribbon Alliance, we've learned that when citizens are engaged, they can, through their voice, demand and hold leaders accountable. We need to open up spaces for citizens to engage and also invest more in citizen-led accountability. We've seen through our citizens' hearings held in over 30 countries with our partners that when citizens are engaged, they can hold their leaders accountable. Citizens have been able to raise their voice. They've given us what they want the government to focus on and how they should be involved in accountability processes. All these hearings have happened in over 30 countries, like I told you, and we've engaged over 400 organizations, individuals, citizens, including adolescents, and all these have been given a platform to tell their governments what they want and how they want to be involved in holding their leaders accountable. We've seen progress. We've been able to take the hearings to our health ministers and also our prime minister, and all of them have welcomed citizen engagement. As you can see, there's already greater support and ownership of the new development agenda. And all we're asking for is to ensure that citizens participate and hold their leaders accountable. And we say that there should be nothing about citizens without citizens.
Sounds like there's far more engagement than there was in the development of the Millennium Development Goals. All right, you have 2 questions from our viewers. Yes, I'm afraid so, Tim. So the first one, could you provide more detail on the global framework for impact? Faridah, pass it to one of the men.
So I'm not sure what the global framework for impact is, but I think it's referred to the framework for monitoring progress and accountability related to the Sustainable Development Goals. Would that be a good guess? If that's the case, then that is still very much under development, and a lot of discussion around what are the indicators we can use to monitor it. How can we create something that really resonates with the world, where policymakers, people can understand whether our planet is getting healthier, whether people's well-being is improving. And then, of course, there is the whole issue around accountability. How are all the stakeholders going to be involved? What about transparency? So a lot of discussion going on right now around the SDG monitoring agenda. And in the end, I guess that refers to the global framework for impact.
So a lot of work to do between now and September. Tim, while I have you here, can you talk about the financing aspect of this? For the SDGs, are we talking more about a global financing or national financing? Give me some help here.
So I think the SDGs really are, over the next 15 years, looking at a major change in the landscape of financing for health development and for development in general. I think a lot of countries are going to move from low income to middle income status over that 15-year period. And in that context, traditional forms of development assistance like grants will no longer be appropriate for countries that are middle income. And so people are starting to think now, in the context of the SDGs, how to anticipate and embrace that transition. And that means we have to put, first and foremost, a lot more attention on domestic resources in terms of public sector, government expenditure, raising money through taxes and other forms, but also through the private sector. And in fact, we know that in most countries now, even low-income countries, government and private sector are usually the majority financier of their health sector. But we know that there's also a very concerning situation that we've seen in the context of the MDGs, which is when more development assistance goes in, government contributions to the sector go down. It's what we call substitution. And so I think in the moving forward in the SDG and the financing for development framework, we'll be really looking at how development assistance can become additional to domestic resources, and that development assistance can catalyze the growth of domestic resources such that by 2030, many countries will be able to sustain the financing of their own health systems.
And that's really going to be a lot of the discussion in July in Addis, isn't it?
It is. And in the health sector, we've got a long way to go, because at the moment, the majority way in which we finance health systems is by asking people, citizens, to pay at the point of service. And this discourages people who need services from accessing care. But if they happen to pay, it's a major source of impoverishment. and approximately 100 million people per year fall into poverty because of payments for healthcare. So if the SDGs are going to be successful, and we're going to eliminate extreme poverty, and we're really going to ensure universal access to services, we have to change not only the level of financing, but also the way in which health services are financed so that people don't pay at the point of service.
You know, the MDGs seem challenging at the beginning, and listening to this, it seems like this is going to be even harder. Faridah, let me ask you one last question. What is your advice on the best way that we can hold governments accountable when it comes to the SDGs?
I'll still insist or emphasize citizen-led accountability. Without citizens, we can't achieve more. We know that citizen-led accountability is the fastest and most sustainable way to bring about change. We know that most of the decisions about women and children are being made behind closed doors by men. We want citizens to be involved. When citizens are involved, we'll be able to see results. Thank you.
Thank you so much for what you do. It's really exciting to hear about the power that could hold and that the voice of the people could make such a difference. Thank you all for joining us. I have to let you go now, but I do thank you for joining us, and I know that it's been a very busy day for you. Thank you so much.